Hello, I'm Dr. Kimberly Leupold, owner of Holistic Healthcare Centers located in Lisle, Illinois. Today I'm with my fantastic office manager, Lisa Zellick, and she is going to play the role of a new parent coming to Holistic Healthcare Centers asking questions about care we offer to children.
Thank you for meeting with me today, Dr. Leupold.
My pleasure. How can I help you today?
Sometimes my child has headaches. Don't know if they're anxious at school. I'm not sure what's bringing it on.
So headaches and migraines, they can be helped amazingly with acupuncture. Acupuncture has been scientifically proven to decrease migraines and headaches, decrease the frequency, the severity, as well as if you have acupuncture coverage, many times with insurance, many times the migraine treatment is covered by your insurance if you do have acupuncture coverage.
I'm not sure that I'm comfortable with my child getting acupuncture at this time. Do you have some alternatives?
Absolutely. So some of the alternatives to acupuncture for children would include Tui Na. Tui Na is a medicinal massage that is taught in Chinese medicine that can elicit similar responses as acupuncture. For example, may I have your hand? There is a point right here, large intestines 4, and this point, when you apply pressure combined with the other points that a licensed acupuncturist would know, it can actually decrease a migraine, and has been shown in studies that this form of acupuncture is very powerful for migraines and headaches. There are also other modalities that you can use, but does your child have any other symptoms?
Let's see, sometimes stomach aches.
So stomach aches, again, acupuncture is great for covering just about any of the different care issues. But if your child is not comfortable with acupuncture just yet, Tui Na is a very useful treatment. And there's actually different treatments such as rubbing the tummy and rubbing the stomach, different types of Tui Na that you can use. In addition to Tui Na, we have what's called color puncture. Color puncture is a treatment that is from a doctor in Germany. It is still fairly new in the United States, but is gaining steam. And it works by using the light, the color, and the crystal, and it actually can have a shift, it can have a change on the photons within your cells. So scientific studies have shown that when you're doing specific coordinations based on the specific ailment, such as a stomach ache, that afterwards, after cells are looked under a microscope, they actually see before and after differences, and the photons within the cells actually create a change. And while the science behind this is still gaining, what we are starting to understand is it's that cellular change that tends to create the change in wellness and healing. What I do know clinically is very often patients that are children with stomach aches, with different types of tics, with anxiety, with many different symptoms that most American children have, color puncture is very productive for them. They tend to have a very positive response, and parents often tell me that after just 1 or 2 treatments, the symptoms that the child came in with are no longer in existence or markedly less.
Seems like it would be a lot less scary and maybe even a little bit fun.
Absolutely. It is. I think it's fun, because what's fun also is if the child is nervous, since there's no harm with it, the child can help me hold the wand. So it also allows the child to have a sense of control in the treatment and the ability to help with their care, which then also gets the child a little more invested in their care. Another treatment that we often use is cupping. So we use what's called fire cupping on adults at Holistic Healthcare Centers, meaning there's an element of fire and a glass cup and it creates a vacuum and is pulling response. Children are terrified by that kind of idea. So we use silicone cups with pediatric treatments. So if I could use your arm for a second, probably smaller because you're very thin. This is a cup, and it just goes on. Traditionally, it's primarily on the back. Since it's an arm, it doesn't stay on as well. But it can go onto your back, and cupping can help with pain, stomach aches, and also because of where the acupressure points are on your back, and the associated functions that they have, you can help reduce anxiety and sleeplessness or issues with sleep simply by doing cupping on the back. So, what?
I've also read that might help with colds and maybe sinus infections.
Yes. So if you have if you're concerned about anything such as like strep throat or something that needs antibiotics, check with your MD. But if it's something like a stuffy nose, or you've already seen an MD and there's nothing that that has to have an antibiotic, such as strep, cupping is a great option. Cupping with color puncture is another great option. So what this does is we have found that with the combination of the color puncture and the cupping, fevers tend to break within an hour of the treatment. Symptomology usually expresses out strongly over that 12 hours post-treatment, and then by the next day the child reports feeling very well, and the parents often report anywhere from a non-ruptured otitis media, which is an ear infection, to a sinus infection that does not need a form of antibiotics for it, tends to resolve rather quickly.
Wonderful.
Well, thank you so much for all your questions, and I'm hopeful that we can help your children.